How does LGBTQ plus advocacy shape care for transgender adolescents? Imagine a world where every young person can access the health care they need without fear or judgment. That's what advocacy aims to create for transgender adolescents. When advocacy groups push for better understanding and support, they help make gender-affirming care more available and accepted. This care includes medical treatments like puberty blockers and hormone therapy, mental health support, and social services that respect each young person's gender identity. These services are tailored to each individual and can significantly improve mental health, reduce feelings of depression, and lower the risk of suicide among transgender youth. Advocacy also works to ensure that healthcare providers are trained to be welcoming and respectful. They promote the idea that clinics should be safe spaces where transgender adolescents can talk openly about their needs without fear of being judged or discriminated against. This means teaching doctors and nurses about transgender health issues and how to communicate with kindness and understanding. Policies are another key part of advocacy. Groups challenge laws that block access to gender-affirming treatments or prevent young people from living openly as themselves. They support evidence-based guidelines from trusted medical organizations to keep these treatments available. Advocacy also pushes for laws that protect transgender students in schools and communities, which helps improve mental health and academic success. Beyond healthcare, advocacy fights systemic barriers like discrimination in child welfare systems, juvenile justice, and homelessness. They push for reforms that create safe, inclusive environments for transgender youth everywhere. This includes community programs that offer resources, safe spaces, and support networks. In practical terms, advocacy leads to more education for healthcare providers about transgender youth needs. It results in the development of clear clinical guidelines for gender-affirming care. It also involves legal actions to protect young people's rights to access care and live authentically. Community programs and awareness campaigns help reduce misinformation and stigma around transgender health issues. Overall, LGBTQ plus advocacy shapes care for transgender adolescents by making sure that medical, psychological, and social services are accessible, respectful, and based on scientific evidence. This work helps improve health outcomes and gives transgender youth the support they need to thrive.